Hey, Suzanne here with caregiverhaven.com. So we have a couple of really great questions sent in from our members that I want to discuss with you today. And thank you for sending them in. I love answering them. If you have the question, then a ton of people also have the same problem and they need an answer too. So thank you for this. Okay, the first question is, we had a 7-minute appointment. The doctor added a new medication and we were basically walked out the door. Mom nodded like she understood. I didn't. Now I'm staring at this new bottle thinking, when does she take it? With or without food? What are the side effects? And are they a big deal? And I'm mad at myself for freezing in the moment. What are the exact questions I need to ask the next time? And this is from Ashley in North Carolina. Thank you, Ashley. Thank you, Ashley, for asking these questions. And first thing, you're right. The average appointment these days in the doctor's office is 7 minutes. 7 minutes, that's it. That's sad. Number two is that of the patients that walk out that door, sadly, they understand 25 or heard 25% of the instructions, 25%. And of that 25%, 50% of that is wrong instructions. They're wrong. So they don't hear what they need to. That is why I've always said in these 7 minutes, you've got to ask certain questions and you've got to have a composition notebook where you write down the doctor's name, the date, what they're being seen for, etc. Okay, let's look at the 3 things we have to ask, maybe even 4. All right. So first of all, the basics. Why are they taking this medication? What's the diagnosis? What are they taking this medication for? All right. The next thing you want to ask is when to take it. Do they take it morning, noon, night, or whatever? Is it okay to take with their other medications? Now, personally, I never trusted the doctor to know this answer. So I always encourage my clients to go to the pharmacy. And when they pick it up, say, here are the list of other medications they are taking at the same time. Can you tell me, can you do a medication reconciliation and make sure that this medication is not going to affect, either enhance the effects of other medications or decrease the effects of her other medications? Very important. The other thing is, what kind of side effects am I looking for that I should call back to your office if this is either not working or it's making it, the side effect is too great? For example, something like gabapentin, which you ramp up. Okay, gabapentin, it's a Schedule 5 in some states. Other states, it's not scheduled at all. But this drug has a definite effect on the brain. Makes people foggy. It makes them, it's at higher risk of dementia, taking gabapentin for long-term use. It also has what we call the, cognitive impairment, memory, cognitive or mild cognitive impairment. So you want to be very careful with a drug like that. So as you ramp up, you want to know these side effects. You also want to know if these side effects are most likely to go away. And again, that's something for a pharmacist to tell you. The doctor won't necessarily know this at all. So always request, why are they taking this medication? What are the side effects I look for? When do I call the office? Do I take it with or without food? The safest medication is something where the doctor is going to keep it off the Beers list, Beers criteria list, BEERS. This is invented by, I assume, Dr. Beers. And what it is a criteria of medications that could be dangerous for a senior to take. So caution is always used when we're prescribing. And we prescribe them, but there's always caution in there. And I want you to know about that. So these medications, if any of them cause the dizziness or confusion, or they interact with the other medications, that's a call back to the doctor, but you won't know that until you talk to the pharmacy. So make sure you always, always, always have an active list of all medications, including over-the-counter vitamins, minerals, creams, eye drops, everything. Anything that goes in or on the body has to be there. Before you leave the office, you also have to confirm a follow-up. There's got to be a follow-up. There's got to be a way for you to get back into the doctor's office and say, okay, this medication worked or it didn't work. Here's why. Because getting an answer from the doctor's office can often, I think over 50% of the messages you send in are ignored. You have to keep asking every week after week after week. The nurse sees the messages, or even a certified medical assistant sees the messages, not the doctor. Most of them they can answer on their own, so the doctor doesn't even see the message. But in many cases, then they put the other pile aside, and the doctor has to get to those. Sometimes it takes days before the doctor gets to them, and the pile piles up, piles up, piles up. So you have to keep asking over and over again. Okay, sorry I spent so much time on this, but it's really important that you understand the medical healthcare system and how to get through it. And these are two people you need to know, the doctor and definitely the pharmacist. Okay, the next question is, Ashley, I gave you a lot there. Sorry about that. All right. Dad uses 3 different doctors, 2 pharmacies, and 1 friend from church who shares his leftovers. I guess his leftover pills. So I found a bottle with someone's name in the cabinet. He says it's the same thing. Don't worry. I know people share medications all the time. I'm sitting here imagining an ER visit over something preventable. What do I do and who do I ask first so we can stop this chaos? And this is from Steve in Illinois. Steve, thank you for this question. This is so true. You are not alone in this. I have seen so many different medications. I could tell you some of the horrific stories. I've seen people take medications from their loved ones who are gone, who have passed. It's just terrible. So the first thing you want to do is start a single medication list, okay, for seniors and for your senior, and make every doctor and pharmacy use that list. I'll tell you a little secret here. When you go into a doctor's office, and remember, 7 minutes with the doctor. So it's usually the nurse or the certified medical assistant, the CMA, that comes in and asks you if any of your drugs have changed. What I always like to say is, tell me what you've got and I'll tell you if it's correct, because I never say yes or no. I always make them read the list to me, not me read it to them. And before we do this, I always say to that CMA or that nurse, do you have the ability to change the status of the medication on your chart? Or is that only allowed for the doctor to do? The reason I say this is I have worked in systems where it was only myself as a physician assistant or the doctor or nurse practitioner, the provider, could change the medication list in the chart, and not the CMA or the nurse. So I don't even know why they asked the questions, because the patients would get mad and say, I already told the nurse I wasn't taking that anymore. And then I'd get yelled at, and it wasn't the nurse's fault. Okay. So what I'm saying is ask, can you change these medications or not? And if they can't, then you're going to have to go in and when the doctor comes in, you're going to have to spend that 1 minute telling the doctor or handing them a copy of the list of everything, including the over-the-counter. But remember, you want to use a pharmacist here to learn more about the interactions. All right. So every pharmacy, every doctor has to get that list. Now, you said that your senior is using more than, 2 pharmacies and somebody from church and all of that. Okay. So pick one pharmacist, one you like, one pharmacy and one pharmacist who is friendly and you like, and they speak on your level. They're not talking all this medical jargon, but they're actually talking in words you can understand. All right. And you might have to, it may take 3. It usually took me 3 pharmacists before I found one who actually talks on the level that one of my clients could understand. And I'd say, this is the guy you want or gal you want. I want them to talk on your level. I don't want them talking over your head. I want them to do a medical reconciliation for you. And I want them to then sit down with you and go over all the medications, the minerals, the vitamins, the creams, everything, the eye drops, anything, ear drops, I don't care, powders, and say which ones are interacting with others. All right. The pharmacist is also going to catch duplicates. They're going to catch wrong doses. They're going to catch dangerous combinations for your dad. The other thing you can do is use the one pharmacy rule. That's because polypharmacy in older adults is riskier when the care is split. And sadly, the care is constantly split because so many seniors have not one, not two, not three, but 4 or 5 different specialists. So not only are the doctors splitting up the care for this one patient, but now your dad has 2 or more pharmacies splitting up the care. But I got to be honest with you, on the other side of the coin is some pharmacies charge more for one drug than another. So if you are price shopping to get the least expensive drug, that's okay. Shop around, but it's up to you to keep this medication list active and current. And what you want to do is, whether they're going to 2 pharmacies or 10 pharmacies because they're shopping around for the best cost of the drug, I can't blame them there, but find the one pharmacist who can talk on your terms, your level, and tell you exactly which medications interact with other medications and do that medication reconciliation for you. One pharmacist to do that. But you've got to have the complete list of medications. You've got to have it. You are the sole responsible person for that. So ask the doctor what meds are high-risk medications in older adults. You might ask the pharmacist this first. Pharmacist will pull out the Beers criteria and tell you exactly what's going on there. So I always go back to the pharmacy first and the pharmacist. Quick note here, I don't say pharmacy assistant or pharmacy tech. They had, they had a couple of hours of training, but the pharmacist is the guy or girl that went through 5 years, had to pass their boards. They know everything. They've spent 5 years doing nothing but studying drugs. They know exactly what drugs do what. They know exactly whether your insurance is going to pay it or not. They know exactly which drugs are cheaper with discount cards and which ones aren't. The pharmacist is the person you talk to. They have a PhD at the end of their name. They are the person you want. I can't stress that enough. This is medication safety. So if this helped, please subscribe, give it a thumbs up so YouTube will share it with others, and make sure you share it with somebody who is also leaving appointments scared or confused and just don't understand. Whereas, like I said, everybody goes out understanding very few instructions. Okay? And be sure to check out the free tool that I have for you. Sign up for it because it's going to help you ask the right questions when you get into that appointment. Take care. I'll see you in the next video. Bye-bye.